Hello, folks. It's Chris Bowling.
It's Chris Beyer.
We are CB Squared in
Hello.
part 3 of our 6 parts.
There we go.
Both wearing the same outfits. You can tell.
Looks good, Chris.
Yes, that we just don't shower. We don't do anything. So today, what are we talking about?
You're talking about direct contracting with providers, or what we consider to be that employer to provider network that takes insurance out of the mix. And this is a topic that we know is providing some tremendous savings for the employer. It's really helping employees have better care and get the best possible doctor to do that procedure. But it comes back to what we shared before, that I think a lot of this started with in a network. When you're looking at a large insurance company's network, you will have the same procedure in a community, sometimes 5 to 6 times different price, and they're both in network.
Right.
I use the example of the MRI, 600 to 6,000 within a 30-mile radius of one of my clients.
Yep. Colonoscopy, same thing.
Yep.
You know?
And it's every provider's in network, and that's always good, but the price is not consistent. So why would a CFO ever want to have any input that they're buying for their company be between 5 and 6 times different price? They would be crazy as a CFO to ever purchase anything with that big of a margin spread.
Yeah, and that is your health plan today, people.
And that is your health plan. You don't have a clue how much you're paying for that procedure, and you can manage that better. So when we look at a direct network, what does that look like when we put that in play? And again, it's got to fit right for the employer, but
right.
How does that work?
So let me get into the weeds a little bit, because we've already had an idiot broker who, you and I talked to his employer, and they're like, you can't do this. It violates every, PPO agreement out there. We're not talking about you, Mr. Mrs. Employer, calling Dr. So-and-so and saying, I want a relationship.
Right.
That is a violation of every PPO agreement that doctor is currently part of. We created something different. So consider it a network that you can contract with, no different than you're buying the Buca's network. You can add a network. And so let's get out of the weeds now.
Yep.
And let's talk about why. So we are fortunate that we insure many of our providers in our area.
Yes.
And the reason this came up is I was in a renewal meeting, and you and I always love to hear about business, right? How is your business doing? What are you struggling with? And it's funny, I got lectured through this renewal meeting when I asked the question, how's business? And they're like, well, 2 things are a problem. You, I'm like, me? They're like, no, dealing with your insurance carriers is a problem.
Yes.
So we get stuff pre-approved, and then we do the procedure, and then the insurance carrier wants to claw it back.
Yep.
But they said, Chris, what's killing us right now is getting paid by our patients.
Yeah. Yeah. Because you look at the normal strategy over the last 10 years, if increase in premium comes to the employer, we increase cost to the employee and we raise deductibles. You're going to see a situation where some employers plans have such a high deductible that employee has to prepay before the surgery because the doctor doesn't think they're ever going to get paid.
That's right. So what happens? Well, they can't afford to be sick. So then they don't go to the doctor. And maybe it was, gosh, I got this little thing on my arm. Well, now it's a $500,000 cancer claim.
Yep.
Which I had this year. So, not me personally.
Yes.
So it really came back to, okay, well, if I got insurance out of the way, I got patient responsibility out of the way, would you offer us a better deal if we're going to create our own network?
Mm-hmm.
And if I put you into that network, I pay you in 7 days.
So the employer the payment is coming from the health plan to that provider in 7 days instead of 3 months sometimes.
Instead of 3 months. And then fighting for what you did get pre-approved is now somehow not getting paid.
Yep.
So let's just make this simple. But I said, wait a minute, here's what I don't like. We're in a fee for service arrangement, meaning, if you've ever had surgery and you're in the room and you feel like you're in a grocery store and they come in with their little scanner and they're scanning everything
down the list,
beep, 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 that's fee for service. I'm like, why couldn't we create bundles? for that knee, don't you guys sort of know what's going to happen through that knee surgery? And they're like, well, actually, CMS is forcing us to get into this bundled services with Medicare and Medicaid.
Right.
So, yeah, you're right. And you know what? We're finding it much more efficient. Our government is finding it way easier to pay because now they're not having to line item everything.
Just one price for the event.
One price. And you've got the best story. Oh, let me say one other thing. This is elective procedures. This isn't I walk outside and I break my ankle. It's I know my knee hurts. You know, we just talked about second opinions. I know my shoulder hurts. So I have something that is elective. So, you know, we're not talking about emergent care. We're talking about elective care. I know
that's surgeries, that's imaging, colonoscopies, MRIs, physical therapy, skin cancer surgeries. I mean, everything that has to basically be scheduled at another date.
Yes. So that makes it easier for us to create a bundle. It makes it easier for the physician to understand what they're dealing with because I'm not coming in emergent and they have no idea what I have.
Right.
It is purely elective procedures.
Yes.
But this thing's growing. I mean, we're now looking at, you know, we just added cancer to this thing. And, you know, eventually we want to start adding cancer drugs to this. So, you know, where it started, but this started 2 years ago. And it's taken us 2 years to build this. You know, and
but we're seeing good success. You know, but like you said, it's getting the doctor paid fairly and quickly. The employer has a consistent price. They know if this happens, this is how much the plan pays. And the third piece that's really changing is then that employer has to agree to waive the employee's cost. So there is no deductible or co-insurance. So now the employee could still, again, go where they want to go. Their traditional plan would pay, but if they choose this network and they make that phone call consultation, there is no cost for that employee. So think about that. If you have that employer that has a $3,000 deductible and a $5,000 out-of-pocket cost, that employee doesn't pay a dime to go in, but the savings to the employer is worth waiving that cost share.
Think about the retention tool this is.
Yeah. Instead of raising deductible every year, we're now giving you free care for the things that you probably need done, but you're putting off because you don't have $1,000, let alone $5,000 to get it done. It's changing that situation. And Chris, as you've said, we're finding the best providers. It's not like we're going to that surgery center and they're like, let us give you the brand new guy that hasn't ever done this surgery. They're putting their best surgeon on it because they know that they're going to get paid one time for this. So you're getting the best possible care at the best possible price.
That is correct. One of the things that we drove quality into this is to say, if you have to repeat that surgery within 90 days, we're not paying.
Yeah.
You know, my shoulder surgeon got paid twice, which is a bunch of crap.
Yes.
He messed up. Yet my self-funded health plan paid this guy $32,000 twice.
Yes.
Ridiculous.
That's another key. So again, this has to fit well, and it has to fit for each employer. This is a great way if we've got, we can't do direct primary care for some reason for that employer and it doesn't fit. We can put a network like this in place so that we're incentivizing the employees with their own financial decision to make the right choice. And it all comes back to education. We have to spend time helping the employees know, number one, that this exists, and number two, why it makes sense for them and why it makes sense for their employer. To be able to say, employee, you make the right choice, you don't spend money. It also helps your employer not spend more money, which means we're not eating up all of our raises by health insurance increases. And we're able to grow as an organization, which means the business does better. I mean, the fallout of this is so positive. So again, as we continue to bring these ideas in our series, direct network, as we would call it, is one of those, one of those levers that we are seeing the best performing organizations pull. We'd be happy to share more about how that works for you and your organization. Certainly reach out and let us know. Chris, we'll talk again sometime soon.
We'll talk again. I got a feeling we might, we might change next.
We might change. Probably time to do so. Thanks so much.
We'll see you.